why don't we get into COVID? Because where are we statistically? I don't really pay attention to the news. I used to look at the statistics. Now I don't. Like, can you share with me where we are with COVID?
Yeah, sure. So like I used to be like pretty much into COVID like from the beginning of the pandemic, but over this like a couple months, I haven't take too much action about it. However, like I still have a good idea where we at by right now. So like for example, Chicago has already raised all the mask mandates. Like
Right.
most of the population has like double vaccinated, up to triple vaccinated, and I know some people who actually got the second booster, right?
Mm-hmm.
Right around that track. So um, right now the variant of prevalence it's Omicron, of course, but the problem is that Omicron is divided into two different categories. It's like the variant B1A and the variant B2A. I don't know exactly where they originated from, but there are some theories about Omicron, to be honest. But the problem between the main difference between Omicron and the Delta variant
Mm-hmm.
is that Omicron is like more transmissible.
Okay. So is that what we're on right now? I thought Omicron was like in the winter.
It was over the winter, yes, but
Is it
here's the
still
deal.
around? There's not another variant that's
No,
come
yeah,
up
no,
yet?
no, no. We're with the B2A right now.
We're in what?
B2A. That's an Omicron subvariant.
Okay.
So that's the
Okay,
one which is
explain
more
this to
prevalence.
me.
Yeah.
How does a virus become a variant? And then how does it become a variant of that particular variant?
Actually, do you allow me to share my screen? Actually, I have a perfect explanation for
Yeah,
this.
yeah.
Okay, let me get into a map because like there's a page called Next Train. I learned in my class, and it's amazingly good to actually explain that question. Let me open it up.
And you're coming from this, we're talking about public health. You're coming from a biological perspective, a researching perspective, and
Mhm.
a statistical perspective, right?
Yes. Yes, but I feel that I want to get more into statistics just because like I feel that like by the methods I learned in my statistics program, I'll actually be able to explain the phenomenon more accurately.
Yeah.
Okay, so I don't know why my screen is like that, but let me put the unrolled tree here. So have you ever heard about phylogeny trees?
I don't think so.
Like let me show you. So can you see this tree?
Yes. So we are
Okay, let me start basically.
okay.
Let me see if I can pull it out. Okay, so here's
What
where COVID
program is
started.
this?
Oh, that's only a web page. It's called NextTrain, where they actually get all the COVID variants and they input it here.
Okay.
So we started here in 2020 with the original variant, right?
So this is like the family tree of the COVID.
Exactly.
Okay.
Yes. That's how like the best way we can explain how COVID is like emerging, to be honest, or like creating another variants.
Wow,
So,
this visual is much it's helpful to
oh yeah.
understand. I can kind of
And at
see
some point
something here.
I didn't know if like vaccines were actually you know did any effect on Omicron, but after seeing this I actually understand now why it's like this going on.
Okay.
So to start with, we start here in 2020, right?
Mm-hmm.
And you can see how this actually like split in two different subgroups. You have the Delta group, you have the Omicron group, you have the Alpha group. And it's actually pretty interesting because you can also see like where in the country which one is the most prevalent.
Yeah, so we're looking at it right here. It looks like the yellow. So the Omicron is the most prevalent, which you
Oh
said is the
yeah.
most transmissive.
Mm-hmm. And let me tell you why. So if we go to the enroded tree, we can actually see like how far from ancestors these variants are. So what happens when the vaccine came over? All the companies, Pfizer, Moderna, and well, the other people who actually developed it, they did it to actually fight the Delta group. But what happened here? We have Omicron, which is like a really far ancestor from Delta. Like they're not even related here, as you can see.
Okay. Yeah, they're far apart. Yeah.
Exactly. So what's the deal with the vaccine here? Like there was a paper published by I don't quite remember if it was like late December or early December of 2021 when Omicron first started. And they actually predicted that Omicron was going to be the new popular variant among us, which actually ended up being the popular variant.
Mm-hmm.
And they should talk about the vaccine efficacy. And with some studies they did, they actually found out that either vaccine you have like Pfizer or Moderna or Sinovac, whatever you have, is not going to help to neutralize the virus as it helps to neutralize Delta because the vaccine was designed for Delta. It was not designed for Omicron.
So why was it designed for Delta and not Omicron?
Because like the mass vaccination started with Delta. It didn't start with Omicron. When we thought that everything was like perfect, like Omicron showed up and the cases there was like a reboot in cases increased again. And well, I think that virulence hasn't changed much, to be honest. I don't know if there's like enough data to support that actually Omicron is more deadlier than Delta, but it's definitely more transmissible just because it promotes immune escape.
And Delta was the more dangerous one, right?
Yeah, remember Delta was like the big deal around everywhere. And people were dying on this variant. Like not so many people have died on Omicron, but here's the deal. People who already caught Delta before in the past can get Omicron just because of the distance in variants here.
This is where it gets kind of confusing, right?
It's quite confusing, but you can get reinfected if you're wondering.
Okay.
There's like 100% chance you can get reinfected.
So what is the? So we've had the vaccinations. Are now that like Omicron is more popular, the vaccines work to eliminate the severity of it?
Okay, so here's how it works. So with Delta, the vaccines actually help a lot in neutralizing the virus. The vaccines already have some neutralization activity. But with Omicron, because Omicron has so many mutations in the spike protein, like the monoclonal antibodies from the vaccine cannot actually neutralize this virus. However, as I mentioned a little bit ago, this paper actually, said about Omicron and all of it. And at the same time, they also mentioned that it doesn't matter like how many booster shots you have, you will not get Omicron out of your body. But you will prevent going to the ER with the vaccines.